Welcome to Medico Apps. In our today's masterclass, we learn about the maxillary nerve. It is the second division of the trigeminal nerve. So the maxillary division, as we all know, is a purely sensory nerve, and it is the second division of the trigeminal nerve. Okay, so let's look at its course. We will be referring to this diagram all through our lecture. Okay, so that it is easier to follow the course. Now, from the trigeminal ganglion, the maxillary division exits. Okay, so this is the maxillary division, and then it passes along through the lateral wall of the cavernous sinus, and from there it gives a meningeal branch. Okay, so before it exits the cranial cavity, it gives out a meningeal branch, which is a sensory branch to the meninges. Okay, it gives sensory branch to the dura mater, and after it passes through the cavernous sinus, it exits the cranial cavity through the foramen rotundum. So this is the foramen rotundum here, and this is the meningeal branch that it gave out, and from there it enters the Pterygopalatine fossa. So this area here is the Pterygopalatine fossa, and from there it reaches the infratemporal fossa. Okay, so this area will be in the infratemporal region, and from there it enters the orbit through the inferior orbital fissure. That is, it enters the floor of the orbit. It runs along the inferior orbital foramen as the infraorbital nerve. Okay, and from there it exits the skull through the infraorbital foramen and gives out its terminal branches. Okay, so this was a brief overview of the course of the maxillary division, and within each of these areas the maxillary division gives out some branches. Now let's look at some branches. So okay, first branch we have already learned, that is the meningeal branch, which is an intracranial branch of the maxillary division. Now next, after it exits, it will give out some branches within the Pterygopalatine fossa. So here we have the branches within the Pterygopalatine fossa. So what are the branches? So as you can see, first here we have a ganglion. What is that ganglion? It is the Pterygopalatine ganglion or the monkey ganglion. Okay, then in this area it gives out of first few branches, that is Zygomatico facial and Zygomatico temporal. So this is the Zygomatico temporal branch, and here is the Zygomatico facial branch. Okay, so Zygomatico temporal, Zygomatico facial. Then it gives a few branches to the Pterygopalatine ganglion, that is this ganglion here, that is the monkey ganglion. So the branches through the Pterygopalatine ganglion are nasal branches and palatine branches. The palatine branches are of two types. We have the greater palatine and the lesser palatine. The greater palatine supplies the posterior part of the palate, and the lesser palatine supplies the anterior part of the palate. Okay, after that it reaches the infratemporal fossa. Okay, and from there it enters the inferior orbital fissure. So when it enters the inferior orbital fissure, it enters the infraorbital canal that is present within the floor of the orbital cavity. So this structure here is the intraorbital canal. Within that area it gives out a branch, that is the posterior superior alveolar branch. So here this is the posterior superior alveolar branch. Then within the infraorbital canal it gives out few more branches, and within the infraorbital canal the nerve is now called as the infraorbital nerve. Okay, now this nerve gives out two more branches called as anterior superior alveolar and the middle superior alveolar branches. Okay, so here we have this nerve giving out anterior superior alveolar branch and the middle superior alveolar branch here. And this, as we learned, was a posterior superior alveolar branch. Now from there the infraorbital nerve exits through the intraorbital foramen here. This is the intraorbital foramen, and it gives out its terminal branches. So the terminal branches are external nasal, internal nasal, superior labial and inferior palpebral. So we have this is the inferior palpebral, external nasal, internal nasal and superior labial branches. Okay, So one thing you should remember is that there is something called as a superior dental plexus. Remember this. Superior dental plexus is a plexus of nerves that supplies the upper teeth. Okay, upper teeth and the mucosa associated with it. It is formed by posterior superior alveolar, anterior superior alveolar and middle superior alveolar nerves. Okay, so all of these together form a plexus, that is the superior dental plexus, and supply the upper teeth. Okay, so these three nerves together form the superior dental plexus. So this was about the maxillary division.